Hello, everyone. My name is Martin Agoje. I'm the National President of ISSUP Nigeria chapter and the member of ISSUP Board of Directors. I welcome you all to this webinar, which of course is one of the webinar series on stigma and substance use. The webinar series is part of the collaboration between ISSUP Nigeria chapter, ISSUP UK, ISSUP Kenya, and ISSUP South Africa. In view of this collaboration, Dr. Pamela Ketura of ISSUP Kenya will be joining me to moderate this session. And to lead the discussion today on the topic stigma, family, and the community are two of my colleagues from ISSUP Nigeria chapter. Dr. Ndidi Ofole. Dr. Ofole is a lecturer at the University of Ibadan, Nigeria, and the focal point on the collaboration for on this project. Peter Adenibuya, Java in Nigeria, and he's a national so ISSUP chapter. Before I invite call the hi to the attendees. Okay. Like I said, Pamela will be moderating this session with me. So at this point, let me call on Ndidi to take it over from here. And let me also encourage participants, the attendees, to please remember to send their questions while the presentation is going on. Send their questions using the chat box, and myself and Pamela will come back to take the questions. Maybe by then, Pamela will say hi to everyone. So once again, thank you all for joining this webinar, and I want to believe at the end of the webinar, we will all be greatly enriched. Thank you. So Dr. Ndidi Ofole.
Thank you very much, sir. Thank you very much, my president, my mentor, and my coach. On behalf of myself, my professional colleagues, and the entire ISSUP Nigeria, we are very delighted to present this second session in the webinar series on stigma and substance use. Of course, this stigma series, as we all know, especially amongst us who are in stigma language prevention, there is a collaborative effort of South Africa, ISSUP Nigeria, ISSUP UK, and Kenya. We are all interested in finding how to curb stigma surrounding substance use disorder and treatment opportunities in our various locales. If we recall that the first series was held on 22nd March 2023, where our amiable Professor Lazzie Jacobs and Paul Ashley discussed extensively on the topic, the language of stigma and substance use disorder. Today, being the 25th of May, this second series that we are going to present is titled Stigma, Family and the Community. I and my friend and professional colleague, Professor Adenibuya, will be discussing how family and communities can impact on substance use stigma, with specific reference to Nigeria. Let me start by appreciating the President and entire members of the Nigerian ISSUP, like I have earlier said, for granting us this rare privilege to represent them in this webinar. We also express our gratitude to ISSUP Kenya. Pamela, are you there? For supporting us in this knowledge sharing journey. Thank you for your support in this journey. Our learning outcome at the end of this webinar are three. The first two, I'll be driving us to learn the nature and characteristics of substance use stigma in the context of Nigerian families and communities. I will also be leading us to learn the stigma and substance use process model. My colleague, Peter, will be discussing what families and communities can do to destigmatize substance use prevention and treatment in our various countries. But I'm sure he will be giving instances of what we have been done and what we can do in Nigeria, hoping that we are going to scale it up in our various countries. First of all, let me talk about for us to understand the enormity of substance use disorder and the treatment problem in Nigeria. It is very essential that we talk about the burden of substance use in Nigeria. The problems of substance use in Nigeria are huge, and it gets worse if nothing is done to halt the trend. Poverty, illiteracy, culture, leadership, and other socioeconomic issues are some of the factors linked to substance use disorder in Nigeria. Unfortunately, treatment of substance use disorder is perhaps the most neglected area of health in Nigeria. Let me briefly refer us to the document that we currently use to make references to the prevalence.
Dr. Ofole, are you there? Hello, doctor. We seem to have lost connection with you.
It's estimated at 14.4%, which corresponds to 14.3 million Nigerians aged between 15 to 64 years who have used one form of psychoactive substance in the past 1 year for non-medical purposes. Among every 4 persons who use drugs in Nigeria, 1 is a woman. More on their locality. Like we are going to learn further about the different locations in Nigeria. So they give it names according to their various local names. So it is estimated that the estimate of the drug use is 10.8% out of 10.6 million Nigerians in the last 1 year. Regrettably, the average age of initiation of cannabis, that is marijuana or Igbo, among the general population was 19 years. That is to say that on the average, initiation of use, the age of initiation of use is declining by what is obtainable in the past years, where people initiated from age 22 to 25. There is also an increase in the use of non-medical use of cough syrup. Some people hide under cough, under the pretense of having cough, to abuse cough syrup. Some get cough syrup and mix it with other materials that are substances. Then the mean age of initiation of heroin was 22 years. Incidentally, the female are more proportionally disposition to use heroin. The reason being that we know that heroin is a depressant, is a central nervous system depressant. So it is reported that women, due to either psychological problem, depression, childbirth, that they are likely to use more heroin than the male. But most worrisome is the use of aphrodisiacs or libido boosters. In the street of Nigeria, they call it manpower or quarantashi, based on the location. In the north, they call it quarantashi. In the southwest, they call it aleku. So this is a drug. There is a combination of substances that I'm going to mention that they believe that it gives them libido, it boosts their libido. Unfortunately, the uneducated ones are mostly associated with local gin mixed with herbs. So that is why when you go to motor parks, garages, and so on, you see hawkers carrying varieties of substances. And even when you try to confront them, they will tell you that it's medicinal because they pretend to put herbs. Among them is one drink that is very popular in Nigeria. They call it alomo bitters. Irrespective of the brand name, there are varieties of these bitter drinks. But studies have shown that all these bitter drinks, there's nothing herbal about them. That is just another way of abusing substances. And one thing that is even worthy of note is that these products are very easy to get and is accessible, it's readily available. For instance, you can sell at as low as 50 naira per shot or 250 naira, which is less than $1. So that will mean that no matter how poor any individual is, the person can easily buy any of these substances, either on the way or in the garage. It's very available at every location. This use and misuse culminate to drug addiction or substance use disorder. The 2018 UNODC survey in Nigeria showed that 1 in 5 persons who had used drugs in the past year in Nigeria is suffering from drug use disorder. Substance use disorder, otherwise or popularly known as SUD, is a treatable mental disorder that affects a person's brain and behavior, leading to the person's inability to control their use of substances. It can be legal substances, it can be illegal, it can be alcohol or even medication. But most importantly is that there's a usage that is out of proportion and which is affecting the individuals. Sometimes the symptoms can range from being moderate to being severe. And when it's severe, that is when the addiction becomes severe, it becomes the most difficult one because it is not easy for the individual to help him or herself because addicted behavior takes time to modify. Substances can also impact the brain that are responsible for decision making, such as even the one to motivate and ability to solve problems and other issues, because an individual who takes drug has a lot of thought distortion, because that is what the substance does to the brain. It leads to cognitive distortion. The individual begins to do things that are not right, things that will put him or her into trouble. Of course, that explains the reason why most of these individuals who use drugs or who have disorders, they are either having one problem or the other. Sometimes they are found around rehabilitation homes, correction homes, because the drug at one time or the other will lead them to such problems. The study showed that 1/4 of high-risk drugs in Nigeria had been arrested for substance-related legal offense in the course of their using drugs. 2/3 of Nigerians who have used drugs, some of them, if they are students, they have missed their going to school. Some of them have dropped out of school. Some of them who are doing work, they are doing job poorly at the concern of their boss. Some of them have neglected their family and their children. So which makes it a very big concern. we know that when you have somebody who has substance use disorder, it's in either way affecting the health, the finances, and the time of all the stakeholders around the individual. It also interferes with friendship, because sometimes people will not have support of their friends. Now, what is the relationship between this substance use and stigma in Nigeria? Let me pause a while, because this is the main discourse of today's presentation. It is found that nearly 40% of individuals in Nigeria who wanted to have treatment for substance use disorder, they are willing to have it. Stigma is a major barrier that has prevented them from having access. And stigma attached to drug use and seeking treatment was the primary barrier in accessing or making themselves available for support. We know that stigma of substance especially affects individuals with substance use problem. It affects their families, the community, the healthcare service providers, treatment, research, policies, and the society. People who use drugs, especially those struggling with addiction, they face a lot of discriminations and barriers with regard to getting help. In several cases, this stigma has resulted in significant physical, emotional, and human rights abuses. For example, in Nigeria, there are places where mentally ill persons are chained and left outside in all conditions of the weather, and sometimes beaten up from time to time in order to heal them, because sometimes their spouses or person related to them will subject them to extensive beating with the belief that they want to exorcise them of the evil spirit that is worrying them. And most times, before this exercise begins, is as a result of wrong diagnosis by individuals who pretend to be professionals who are not experienced in the field. Stigma is when someone sees one in a negative way because of a particular characteristics. Nigerian family. Our country, Nigeria, is the most populous country in Africa and the world's sixth most populous country. With due respect to my African colleagues, there's a general saying that when Nigeria sneezes, other African countries catches cold. In terms of population, human resources, material resources, Nigeria is abundant. Nigeria has 36 states and federal and FCT, which is located at Abuja. The beauty of Nigeria is that it is inhabited by more than 250 ethnic groups. And this ethnic group, they speak 500 languages. Sometimes we don't understand ourselves. And the same way we speak different languages, that is the same way we give substances names based on our dialects. But in all, in Nigeria, there are three major ethnic groups. We have the Hausas in the north, the Yorubas in the west, and the Igbos in the southeast. These are the three major ethnic groups. Then Nigerian family, because our topic is stigma, family, and community. So let us position Nigerian family and see what it is, how it has promoted stigma, and what it can do to impact on stigma treatment substances. Nigerian families are patriarchal, with extended families having more say than usual in comparative to family in other world. I know that most of our colleagues in other clients, there's a limit to which you can interfere with their family activities, both nuclear and extended. But Nigeria is not like that. Nigeria is living a general family system. So every individual has access to your family. Then children are very important to Nigerian families because they believe that the children are the one that will take care of them in old age. You can imagine an instance where child now has a substance use disorder. The family affected will think that that is the end of their lives, that the hope of being taken care of by their children is being thwarted because the person is having substance use disorder because of the importance placed on children. Then the community where we live is a place for both the individual and the family. So sometimes we congregate on family members, sometimes we congregate on community levels. But in some, Nigeria is a family that we are said to be our brother's keeper, both in times of pleasure, in times of stress and disaster. And when there's a problem, it becomes a problem of all. So this makes it possible for them to provide material and non-material care and support to its members, from children to older persons or any individual suffering from illness, sheltering them from hardship. We know in other climes, we have old people home, we have gerontologists where people are kept at, but in Nigeria, everything is done within the family context. So an individual who is having substance use disorder, there's no home, or maybe very recently they have 2 or 3 homes, but we are used to caring inside the family setting. Incidentally, as a result of the way we are related, the norms and values of Nigerian society guides a lot of things that are being done. And these norms and values are being directed by 4 things. Number 1 is knowledge. People have limited knowledge about substance use disorder. And as a result, it pushes them to whatever information they are going to do. The second one is the degree of contact or experience that they have had with people with with substance use disorder. Because sometimes, because those who have the issue, they are left to wallow in the streets. So at night, they can display some behaviors that will make them as if they are very deadly. Another issue that is driving the problem in Nigeria is media portrayal of people with substance use disorder. They portray them even as worst form of mental disorder. They even prefer other things. Sometimes when somebody is involved with robbery or kidnapping, they relate it to substance use disorder. So there's a general belief that people with substance use disorder, that they are the cause of their problem. That since they are the cause of the problem, they don't need any much support. Unlike other individuals who have something like who are diabetic, who have depression and other forms of illnesses. When it gets to substance use disorder, they believe that the individual is the person doing him or herself. After all, you use your money, you went to buy the drink that put you in the drink or substances that put you in that particular condition. So the level of pity you are going to get is very minimal. This is in line with what Goffman described as courtesy or associative stigma. That is family stigma, because no family in Nigeria, or else, especially Nigeria, we like to identify that one of their family members has substance use disorders. So they prefer to change the person or hide the person away from the visitors, because to them, the person has brought shame to the family. To them, the person has disgraced them. The person does not have a moral control to decide not to take more than what is expected. So they will be on condition of blame. So government call it family stigma, because the stigma has extended to the entire family. As a retaliate, the entire family is also looking at what they can do to avoid being associated with that stigma. So the scenario I have just painted will now lead to a society in Nigeria where people go and hide because of what the society will think about them. They hide underground, and if they continue to hide underground, how can we move forward? It's not possible that substance use disorder can be curbed if something is not done. So in view of that, I want to put it in perspective that in Nigeria, there are 3 basically types of stigma that are driving. We have the self-stigma, like you can see. It makes people to internalize negative messages about themselves. The environment they live will make them feel, who am I? What can I do? I'm nobody. I have brought disgrace to my family. It also makes them to have fear of accessing quality treatment, because when they get there, they first of all ask family names. Which compound are you from? Where are you from? Where is your state of origin? Your parents, and so on. Information that shouldn't be part of a medical history. So sometimes even those who have gone to a quality healthcare, they will not even refer their colleagues who have the same problem, because when they refer them, they will say, oh, so you two have suffered from the same illness. So they just hide it. Of course, an individual who is facing all this will have a low self-esteem and feeling of shame. You know that self-esteem demotivates an individual. It takes away the push to actualize in individuals. Sometimes people with low self-esteem, they have suicidal ideation. Sometimes they even go ahead and commit suicide, because to them, what is life worth living after all? You know, sometimes they have negative attitude towards them. They label them. Like you can see on the image, everybody try to label them because of the society. Everybody is pointing at accusing figures. Let me also mention at this point that there are other stigmas in Nigeria. So we have HIV-related stigma, we have depression. But we know, because something like HIV-related stigma is associated with the other modes of contracting, apart from sexual transmission, something like parent to child. So some people, because of other modes or blood transmission, so people are freer. They are more proud to identify that they have somebody living with HIV than somebody suffering with a substance use disorder, because they are yet to understand that sometimes individual can have the genetic trait or whatever, just like any ailment. In the structural stigma that we have here, the policies of healthcare service is not even helping matter, especially when it gets to youth home. There are few youth-friendly facilities, and again, some of the health service providers, they have negative attitude to them. The workplace sometimes also don't help matter, because in the workplace, they are not giving the attention and leaves that they require to do. So as a result, not connecting people with health or social services because of their will lower their quality of life and everything concerning them. Yes. Now this model, I'm sure that by the time we saw this model, you'll be wondering, this substance use model is very interesting model, because it's researchers and program designers and experts, they didn't just fold their arms and watch people die of substance stigma and other stigmas. They went in to find out what can be done. How can people be helped out of substance use? So they started projecting different types of model, because we know that for effective intervention, it must be anchored on evidence-based model. So we have progressive model. We have cognitive model, we have motivational of stigma. However, stigma, like this mentioned ones, or like this ones I have just model, a promising. Yes, unlike the previously mentioned substance use prevention model, the one that holds promise for achieving sustainable stigma reduction in Nigeria is the process model of stigma. According to the theories, stigma is caused when people have an interest in helping others to come down as a way to have access to their resources. That is to say that the Nigerian society will support an individual to have low self-esteem, to be depreciated. So to them, is a power play. They call it stigma power. So the more the individual is down with issue of a stigma, the better for them to inherit and acquire whatever resources that is accurable to the individual. If you recall that I said that in Nigeria, everything is a communal ownership. Sometimes they have communal land, sometimes they have communal properties, sometimes they have things in common. So as a result of the constrained, limited resources available, stigma in Nigeria, the model that first is this process model. So they use, first of all, to label the individual. It has 4 processes. When they identify things that will make them to label the individual. Even when it's not real, sometimes they can even label somebody, you are a drunkard, even when it's not obvious that the person is drinking. They can say your family is epileptic. Just as a way, according to this process model, to devalue the individual. We hope that when the individual is down, the individual power of negotiation for the limited resources will be very down. And those stigmatizers will now have upper hand to acquiring whatever that is left of this person having SUD person. The next thing they do is linking it to stereotypes. When the person passes, they say, this is the person I'm telling you about. This is the individual that I'm describing. This is him. The third one is that they begin to use them and use us and them. You know, we are our own family. For example, I want to give us an instance. If they want to talk, they say, you know, in our family, we don't drink, but that family, they are known as they are drunkards. I don't think anything coming from that family. So the next one is discrimination. They try to discriminate against individuals. You know, when people are discriminated, it means that they don't have opportunity to mingle. In summary, this process model is trying to say that if stigma of power is the issue, that people should be empowered, individuals should be empowered with the knowledge to know that the essence of devaluing them is for the purpose of acquiring whatever that is left of them. And as such, they should be strengthened to fight up and take up what is left of the family and of the communities in relation to them. On this note, I want to bring in my, sorry, this is the direction, this is the label. They label them, they stereotyping, they separate them, they lose their status, and they discriminate in order for them to take whatever that is left in this end. So, in concluding this, my particular presentation, I want to state that stigma, though powerful and enduring, is not, taking it away is not that it cannot be achievable. There are 2 important aspects to challenging stigma. Challenging the stigmatization on the part of the stigmatizer, that is those people stigmatizing, and challenging the internalized stigma of the stigmatized. On 2 hands, the person stigmatizing and challenging the internal, that is felt stigma. So Campbell summarized 3 approaches that can be used to educate individuals about non-stigmatization, effort to legislate against discrimination, and the effort to mobilize participation of community members in anti-stigma effort. I'm sure that by the time Peter comes up, Peter will tell us what exactly family and communities can do in order to destigmatize substance use disorder and treatment in Nigeria. Thank you very much.
Thank you so much, Dr. Ofole, for that presentation. So, Peter, please take it up from there.
All right, thank you so much. Thank you so much, my president. Good afternoon, good morning, good evening, wherever you may be all over the world. I'm going to continue from where my colleague stopped in area of presenting stigma of family and community. So as we all know that drug use is a highly stigmatized behavior, as a professional, we all know that, and it's mainly viewed as a controllable behavior or weakness of character rather than a disease. Whereas as a professional, we know that substance use disorder is a disease because it affects the brain and also disorganize the structure and the functioning of the brain. So stigma can be said or can be defined as a mark of disgrace, devaluation that sets an individual and family apart from others. So it comes with guilt, helplessness, anger, sadness, frustration, isolation, anxiety, worry, shame, stress, and believing that they have no future. Okay, so stigma is sometimes described as imaginary stain that we see on human beings. So family will still be struggling with difficulty related to extreme stress, anxiety, distrust, deteriorating relationships, feelings of powerlessness, and codependency. These are part of things we see. In course of my interaction with some of my clients, some of them, say something about stigma. They look at stigma as a passive stigma, that's from their own perspective. Somebody said, I cannot do anything. I'm sad and ashamed. My heart cries without tears. I hope God helps me. So that's from the individual perspective. Then family attitude towards the client also indicate that family members provide minimal support because of stigma and shame. For instance, somebody said, they do not support me. Sometimes my parents are ashamed. My father is not proud of me in front of other people. The community as well. Some time ago, I had a client that was discharged. He was working before he was admitted. So after discharge, I was trying to do integration back to that workplace. But unfortunately, the client was rejected. And the now said, he now told us that they said that you are an ex-addict individual. So these are stigmatized words, that is more or less like common among people in our various society. Then the question now is, how do we erase stigma in our community, irrespective of the community, either developed world, underdeveloped, or developing world? So let's look at an individual. What are the things we can suggest for an individual to do when it comes to the issue of erasing or to erase stigma? They should be able to get substance use disorder treatment that is necessary and that is affordable and that they can access. So try not to let fear of being labeled, stop them from getting help. That's one point. The second point is that do not believe it. That is, don't let other people's ignorance influence the way you feel about yourself. So as a therapist, we should inculcate this idea into our clients, and we should also let them know that they don't need to hide away from people. Many people with substance use disorder wants to isolate themselves from the world because of the label. People look at them, give them some kind of name, had it thrown away, or different kind of names like that. Then they should try as much as possible to reach out to people they can trust, like family members, friends, coaches, or religious leaders. So if they do all these things, it can also help them to erase, that kind of stigma. Also, there's need for them to also connect with others people, joining a mutual support group, either online or in person. This can also help them to deal with feeling of isolation. We have different kind of mutual support group that they can join. At the same time, they should also see that they should not define themselves about the illness because there's power in the language. Then it is not personal. They should also know that these problems of stigmatization is not a personal thing, because they should also remember that other people's judgment often come from a lack of understanding of what they are going through. Because for we as a professional, we know that it's a relapsing brain disease, characterized with drug seeking, and getting and use despite the consequences. So the other people might not know, but for them, they know that it's a relapsed brain disease. So they know that once they have a better place to, to get treatment, then they are good to go. What about family? Is it necessary for us to involve family to eradicate stigma? Yes. Why? Because family can be said to be one of the agents of socialization. And irrespective of your country, either developed, underdeveloped, or developed country, family is very unique and is very, very vital. So a family is not just a collection of people. So talking to individual in isolation does not really help understanding the problem in totality. So there's need for you to involve the family members to be able to gather history, do a comprehensive assessment. Then from there, you're able to know the best way. For instance, a cake is not just a combination of ingredients. So in some ways, information from individual members might not be sufficient, to understand the problem in its entirety. So understanding how family members interact and relate to each other is very vital and important. Do we need to involve family in eradicating stigma? Yes. Why? Because involving family, when family involvement in substance use disorder treatment is positively associated with increased treatment engagement, that shows that the client will be able to know that this is a family thing and I have to be around. Then also decrease dropout rates during treatment. Because when the client knows that everybody is supporting you in the journey of recovery, then you'll be able to stay in and able to complete the sections, and also brings about better long-term outcome, because recovery is a roadmap, it's a long journey. So once the family member is involved, then the client will be able to do well. When family are involved in treatment, the focus can be on the larger family issues, not just on substance use case. So both the individuals with substance use disorder and the family members get help they need to achieve and maintain abstinence. The purpose of recovery is to maintain abstinence. So once the family is involved, the recovery capital, the strength of the family can all be used, in helping the client to recover. Then what are the things we expect the family to do? Speak out. They should be able to speak out. When they speak out, what are the advantages? So as you learn more about addiction, as families are learning about addictions, the treatment and recovery, they might likely to notice some misinformation and some adverse effects of stigma on the life of the clients or their loved ones or the member of their family. So when we speak out, we challenge inaccuracy, we educate others, and also guide them to authoritative source of information. The advice is that don't be quiet, speak out. And there's need for us also to educate general public that recovery is a dynamic and multifaceted process in which success is measured through improvement in multiple biopsychosocial model or domain, and that these improvements are often incremental. That shows that when you educate other members of the public, there's tendencies that people are getting to know the best way to address people that have substance use disorder. So when the intimate member or partner is willing to also join, it also brings about effective treatment outcomes. So the presence of significant others in recovery within the family members, among social contacts also can also help to eradicate stigma. Connection and access, to conventional institutions such as school, workplaces, a place of worship and community organization can also help. In churches, in mosques, in all our town hall meetings, we should be able to go out and educate people about the negative influence of stigmatization. Then you're able to assess, opportunity that can also bring about recovery in the life of our people. Do we need family to eradicate stigma? Yes. Why? Because it's going to increase family support for the client's recovery. It's going to prepare the family to what to expect in early recovery, not to have unrealistic expectation. Many patient relations, they have unrealistic expectation. Once they bring the patient to the facility and they want us to perform miracle and the patient will just get better like that, well, we need to tell them it's a gradual thing, it's a long-term process. So we need to educate them and for them also to know. So when we educate the family about recurrences or relapse warning signs, they're able to know the high-risk situation, the low-risk situation, and how to help their patients to navigate all those triggers that might precipitate, relapse, and also relieve the burden of care on the family members. Then when we involve family, in area of eradicating stigma, it's going to help them to identify and support a change of family ways that works with discriminations. And then it will enable family to see the need to make the necessary changes in their lives and take responsibility for their emotional, physical, and spiritual recovery. Now, we talk about individual, we talk about family. Let's talk about community. What are the roles? What are the efforts? What are the things expected of community, to do in area of eradicating stigma? The first one is to have infrastructure, treatment centers, and recovery homes, and recovery ministry. If we have them in nooks and crannies of our homes and our villages, that people can afford it, people can access it, and it's something that people can have, they can go in and out of the place, and people will not be stigmatized because it's everywhere in the community. So if the community can do this, it's going to also help to reduce stigmatization. Then recovery mutual aid and support resources. If these mutual support groups are accessible, like 12 steps, AA, that's Alcoholic Anonymous, NA, Narcotics Anonymous, MA, Marijuana Anonymous, and the one which we started in my facility here in Nigeria, we call it PPTF, Patient Parents Therapist Forum, just like a triadic form, where we have patient interacting with the therapist, and the therapist, I mean the psychiatrist, the social worker, the psychologist, the therapists, the nurses, all the members of the health team, they interact with the clients, and the client also interact with them. Then the therapists also interact with the family members, and the family member also interacts with the client. So the triadic form makes a better assessment. At the same time, once we have a better assessment, then we have a better treatment plan, then we have a better diagnosis, and then the prognosis will be far, far better. The sources of sustained recovery support and early reintervention, because there may be lapse that can result to relapse. So there may be sleep. That's what we are saying, that if the community have a way of helping people, it will go a long way when they have a program after discharge from the hospital or from the residential facility. It's going to really help the client to do well after discharge and also erase the stigma. Then let's look at approach together, every one of us, either family members or individuals or the community. What are the things expected of us as a therapist as well? There's need for us to increase awareness and knowledge about substance use disorder and mental health. Then there's need for us to give psychoeducation about stigmatizing language and its impact on population health. Then we should be able to engage various community partners, NGOs and other stakeholders in conversation about substance use disorder and mental health. Then we should be able to provide opportunity to interact with people, with substance use or mental health disorders by having a contact-based education programs with them. When you organize a program, a seminar, a symposium, whatever, when they come around, whatever you are dishing out at that point in time is going to be what they will now be saying and what they will be doing after the session. So as a therapist now, what should be our role? What should be our impact in helping to eradicate stigma? The best way to eliminate stigma are to first pay attention to our language we use when we talk about those with substance use disorder. So as a professional, we don't expect to say you addict, thrown away, clean, dirty. All those words are stigmatized words, which we as a professional should not imbibe or we should not even use at all. So we need to focus on the person, not their behavior. The person is always of value, unconditional positive regard, and deserve kindness and empathy from us. And these are things that make us a professional, a skilled professional, to be able to help our clients better. So it is also important to distinguish the person from his or her behavior. When we disagree with someone's behavior, we must always value the person, which I talk about dignity and self-worth. Then we also need to have positive expectation for ourselves and for other people. Let's quickly look at this preferred language that I would likely to share with you to this moment. We have some stigmatizing language and we also have some preferred language here. So as a therapist, you should be able to know what is expected of you to say, that will encourage your client to invoke, chain talk, and will make your client to give more information. When you address them the way you should address them and they are happy with you, they're able to talk to you. So instead of using abuser, addict, alcohol, you can say a person with a substance use disorder. Instead of you say clean screen, you can say drug free, substance free. Instead of you saying lapse, relapse, or sleep, you can use a single use after no use, or recurrence of use, or resume use. So what about pregnant addicts? Those are the stigmatized words. When someone is pregnant addict, it's not really right, but you can say woman with substance use disorder who is pregnant. So if we learn all these words, it's going to really help our client to move more closer to us and see that we are really, we really want to help them in the course of their journey. I have this story of elephant, which I want to quickly use to illustrate the scenario of stigmatization. There was a king in my village. During his birthday, he was presented with a baby elephant. So he put the baby elephant in his courtyard. So after several years, the baby elephant now becomes so big, and that space cannot contain the elephant. So he tied the baby elephant, he tied the leg of the baby elephant around 10 centimeter radius. So the elephant cannot move around more than 10 centimeter radius. So now this elephant is now big, so he now told the servant, go and prepare a better place for my elephant. So they went to prepare a very large field for the elephant with the hope that the elephant will be able to move around and be able to do, move around, because there will be freedom for the elephant. Unfortunately, when the elephant was placed in that new environment, the elephant was still within that 10 radius. You see, within that 10 radius, And the reason why the elephant is within that radius is because he has used to that environment. Many at times, many of us who are having substance, people who have substance use disorder, and our society, they have this stigmatized world, you know, for them, even before they even go into using of psychoactive substances. So what should be our role as a professional is for us to speak out. Let's tell people that even when you have a larger place, you can still explore, you can change. You can change. Like that big elephant now has a bigger place, so it can change. So we need to let people know that all those what we are saying should not be just what we should continue to say, but we can also change all those words and also do better. So in summary, reducing and ending stigma and discrimination for individuals with substance use disorder and the medication that treats such disorders starts with each of us. Then there's need for us to take care with the language we use, you know, which can also reduce and prevent stigma and discrimination. So helping to share facts and dispel myths is part of our responsibility. There's need for us to be able to listen to people who depend on you as a therapist or as a family member for their care. Then turning to non-verbal communication is also important. Then being fully present when you are with your people, when you're with your clients, you have to listen. Active listening should be part of what you should be able to do. Then reducing stigma and discrimination is one of the most powerful things recovery ally, you know, can also do to help others. So in conclusion, the role of family and community in curbing stigma among people with substance use disorder cannot be overemphasized. So for better prevention, treatment, and recovery of an individual with substance use disorder, the family involvement and provision of adequate facility in the community will also help to curb stigmatization. So if you all join our hands together with the families of people with substance use disorder, our society will be free of stigmatization and there will be improvements in treatment outcome. Thank you so much.
Thank you so much, Peter, for that. Brilliant.
Dr. Martin, can you hear us? Is everyone hearing Dr. Martin? I think I'm the one with the problem.
Yes.
Use in Nigeria, and of course the burden associated with it. Okay, thank you. Then also shared the challenges of stigma in Nigeria, as well as the factors that are responsible for the situation. Dr. Ofoli also highlighted the types of stigma, such as self, social, and structural stigma. Also highlighted how to challenge stigma, more of a recommendation. Then the steps to help address the issue of stigma at the individual, family, and community level was highlighted by Peter, and why each of these, particularly the community and the family, should be involved in addressing the issue of stigma, and also involved in the treatment of members who have substance use disorders towards addressing the issue of stigma. Peter also provided some terms that are stigmatizing as well as alternative to those terms, and both speakers made recommendations on the way forward. So once again, let's see what the attendees have, as questions for the speakers. Pamela, are you there?
Yes, Dr. Martin, I'm
okay,
here.
So I think one of okay, please go ahead. Go ahead.
Okay, thank you so much. I wish to appreciate the presentations. Right now, I want to bring the questions as from the chat because we have like 4 of them. I will ask at least 2 of them, then we can have response and then move to the next 2. First is a thank you from Joan Kazini. He has left, but he said thank you for this presentation. There is a question from Kumar Sharma. Drug use is a victim, not a criminal. So take action on who provides the drug to these people and give him. Okay, this is pointing to the fact that we should not focus only on the person that is abusing, but also focus on the people providing the substances. Thank you, Shama, for that comment. There is a comment also from Dr. Kamar, Professor Kamar. He says, greetings to her from Health Mission, Calcutta, India. And the question is, how can we help to convince a person who have been stigmatized on drug use and such as let him to some signs of suicidal thoughts? Okay, it is like, how can we be able to convince this person who has already been stigmatized and has reached a point of that they are giving up and kind of having suicidal ideations? Can any of the presenters comment on that or respond to that question? How can we support this person who is already using substances? They have reached a point they have been so stigmatized to an extent that they are developing suicidal thoughts. Didi?
Thank you very much for the question. In fact, it's a very relevant question to our presentation. That is an area that I'm sorry that due to time, we did not emphasize on how counseling services can be brought in. Can you hear me, please? Can you hear me?
Yes, we can.
Yes, we can. Yes, we can hear you, except that we can't see you very well, if you don't mind.
Where I am, I'm in the vehicle. I'm in the vehicle.
Please go ahead.
Yes, so such individuals should either be referred to counseling services, especially to the one that is offered by professionals. When they have when they cannot help them, when they have a low self-esteem and they cannot help themselves any further, there is need for counseling intervention. In that counseling, there are specific things to be done. One of them is cognitive restructuring. It's a tool that has been found to be very effective for persons with substance use disorder. Cognitive restructuring will enable, because sometimes they now have irrational thought processes because they feel that why should it be me? Of all people, why should it be me? And sometimes they have they lack the skills to initiate problem solving. So in counseling intervention, those irrational thought processes will be replaced with a more rational one. and you know, things that are more problem oriented. For instance, we have for problem solving skills, you know, you get the individual through how to solve life challenges, because some of them, they are unable to solve specific some life challenges that come their way. So that is my own contribution to that. They will be referred to counseling services to professionals. So my boss can also contribute.
Okay, maybe just to save on time, as he contributes to that, he can tie it with the question from Dennis. He first of all appreciates the presentations. He says they are very insightful, but asks, are we seeing the same problems with alcohol use, especially in Nigeria? Are you seeing the same level of stigma with alcohol use, or is basically on the drugs? And is asking, does the person who gets ashamed have a sense of reasoning? Do they also develop mental disorders? So, Mr. President, you can tie those two questions so that we can also save on time.
Can I contribute, or is Peter coming in? Is Peter coming or not? That's why.
Okay, all right.
Yeah,
Let me just.
Can
I say something?
Yes.
Can I go on?
Yes, please go on.
Please go on.
All right. Okay, thank you. I want to thank Dennis for his question about the use of alcohol. That do we have people that also, you know, abuse alcohol, you know, drink in our own country in Nigeria? Yes. Many a times we have people that have problems with alcohol, and when we look at alcohol itself, is depressant, and which is more or less like depresses the central nervous system, and then because of that, when people are drunk, they tend to, you know, forget so many things, and at the same time they also get, you know, to misbehave. So with these questions about reasoning, and then people want to commit suicide about substance use disorder, I think in my own view, the person might need to see the specialist, especially SUD professional, substance use disorder professional, to carry out a total and comprehensive assessment before you're able to know the kind of intervention that will be appropriate for that kind of a person. You know, before someone wants to commit a suicide, there are lots of issues. You know, my society having some mental disorder, which we can liken to depression, you know, as a result of what people are calling him, probably at home, at work, and even among his friends. So there's need to do a proper assessment. With that proper assessment, then we're able to know what and what we can do. Though I agree with what Dr. Ilidi said about CBT, which is more or less like going to really help the client in the area of getting over his problems. And when it comes to the issue of suicide, it's not something you just take just like that. It's a serious case, because that time the client is thinking of ending it or making sure that he discontinues his life, there's need for us to let him see the reason why he can't kill himself. And there is help and there is hope. At that point in time, the client must have gotten to a stage of hopelessness and helplessness. There's no more hope, there's no more help. So we should be able to give a kind of assurance that what are the things you need to do, you know, to eradicate or to stop, you know, all these your substance use. And once you stop the substance, then your life will become better, because it's because of the substance that people are stigmatizing. But if you stop that, you will see that people will also look at you in another way, in another form. So the person might need counseling or psychotherapy, but by and large, assessment is very, very key. And assessing the client might not be enough, but there's need for us to also involve the family members. Once the family members are also key into that, it's going to give the client more confidence to live a better life, and also to see the reason why they have to live. Thank you.
Yes, thank you very much, Peter, for that wonderful contribution.
Okay.
I want to add to what he had just said.
Okay.
that in Nigeria, while alcohol is seen as a kind of social involvement, taking of alcohol, substance use is having a higher level of stigma, despite the fact that both of them have almost the same negative outcomes. For instance, in Nigeria, alcohol is offered in social gathering. Majority of gatherings that are done in Nigeria, there's alcohol. Alcohol is lavishly presented, unlike other substances that are not presented. So that is why sometimes individuals who abuse alcohol are even praised as being man enough, as being strong enough to stand the challenges of taking the alcohol. The substance, apart from alcohol, other substances are seriously attached to stigma. And so I want to also add that it is very rare, because studies have shown that those who abuse the alcohol, they are also into substances. They are also into other high-risk behaviors, such as multiple sexual partners, other risky behaviors. So these behaviors are interrelated. Alcohol and alcohol intake, substance misuse, cigarette smoking, risky sexual and unprotected behaviors. So the stigma attached to alcohol is not as much as that of other substances. Thank you.
Thank you, Ndidi, for that. I am cognizant of the time, and I want to combine a few comments or questions. There is a question on the fact that services are not very available. Could that be presenting also as a stigma issue? There is also the debate of is stigma also likely to be contributing to the rate of relapse? And tie the same to another question where Musa is asking, what is the role of the government in reduction of substance use? And I wish Mr. President could respond to that. Or even Didi, any one of us can the presenters can respond to the questions.
Yes, if you allow me, let me say some things about that questions. I want to thank the person that asked the question about availability of infrastructure that has to do with helping people that have substance use disorders in terms of health facilities. Do we have enough in our community? In Nigeria, we don't have enough. We have a lot of people that have substance use disorders, and we don't have enough facilities. Even if you have enough facilities, you have the personnel that are equal to the task. Do we have people who are well trained when it comes to the issue of helping people with substance use disorder? But I can say that in Nigeria, so we are trying now. We are more or less like our eyes are opened, unlike before. So if we keep on, getting government support, especially all the institutions has been established, like with my facility and other rehabilitation centers we have. If the government can equip them and make them, a better one, then people will know that they have a place where they can, go and seek support. But if all these facilities are even there and they are not affordable, that's another problem. And if all these facilities are there and they are not accessible, that's another problem. You can imagine somebody living in a village and you have just only one healthcare center in the city. For traveling from the village to the city might even discourage the person to seek help. Whereas if that unit of that the facility is also provided in that community, and the treatment center is being very close to the people, there may be kind of people who might want to seek and sort out for those kind of services. So stigma also, like another question also says that can stigma also contribute to relapse? Yes, yes, when you say some words, that is not really right, to your clients or to your family members, it might trigger, continue or recurrence of use of those psychoactive substances. For instance, if a client say, "Oh, you are not doing well. You are this, you are that. I don't want to start using those words myself." So at times the client say, "Okay, everybody is condemning me, so why can't I even go back again to take?" And all this also depend on the stage of change. If you have a client in pre-contemplation stage, the way you're going to attend to that client is different from when you have a client in action or maintenance stage, or when you have someone in contemplation. That's ambivalence. Should I stop or should I not stop? And you're still using all those derogatory words. You can say, "Oh, so why am I even suffering myself from even taking this right decision?" And when you have someone in maintenance stage and he has been able to abstain for 2 or 3 years, and someone is coming in after a lapse and started raining abuses on him and said, "After all, what I have wasted all my time abstaining from these substances." So it might lead. But if the person himself also gets to know that all these words can come, but I need to stay, in the course of my recovery, it will help the person to, because this thing is individualized. It's not about family, it's not about community, it's about the person himself, and wants to know that I'm already living pre-contemplation, I'm left contemplation, I'm now in preparation, okay, I'm jumped to the action, now I'm in maintenance. So with that, the client will be able to do well over a period of time. And when we look at recovery is a long-time process. It's like a roadmap. It's a long-term process. Then, what are the roles of government? What are the roles of government? So it depends on the priority of each country's government, what they think is important. Like here in Nigeria now, our president and the NDLA, the chairman of NDLA, they are doing fantastically well in helping to curb the issue of drug demand reduction or drug supply in our community. So all these barons, they more or less like they know where to get them, and they're seizing all these substances from them. So they make it difficult for these things to be accessible, to be available in the community. So this part of things the government should also give more priority to. Apart from drug demand reduction, what about the consumption as well? So when this thing is no longer available on the streets, then definitely people will have access to it. But unfortunately, when all these drugs are also being kept away from people, they also improvise under means of also getting high. We went for a research and we got to know that some human feces, they will dry it and will mix it with Indian hemp and they smoke it. The gum, the glue, all those things, solvent. So these are things people are also using. You see some people just holding a Coca-Cola bottle, whereas the content is cough syrup that's inside their codeine. That's what they are drinking. So what we are saying, in essence, that if the government can give more priority and give more attention, in drug demand reduction or supply, it's going to really help, people to shift their focus from availability to something else that might also better their life. Thank you very much.
Thank you. As I wrap up from my side, I want to recognize that such discussions are actually giving even opportunities for actions. As I see Professor Kamal indicating that because of this understanding, he is going to set up an anti-stigma forum, which actually, if it heals, and we pray that it does, it is as a result of this kind of awareness. As I return it to Dr. Martin, I would like maybe for him to look at the role of the media in all these destigmatizing campaign, even as you wrap up for us. Thank you.
Okay, thank you so much, Pamela, for the excellent moderation. I don't think I will excuse you yet, so you still possibly will go through the chat box and see whether there's any other question. But before then, let me once again commend the speakers, Peter and Indidi, for brilliant presentations, and also the response to questions. Just like Peter said earlier on, the issue of suicide should not be taken lightly. there should be intervention immediately, including referral to the appropriate authority or expert in suicide issues. Because even the idea of committing suicide requires attention, so that is very important. Again, let me add that the question of whether persons who use alcohol are being stigmatized in Nigeria, I think that has also been well responded to. The answer is yes. The answer is yes. So when we talk of stigma here relating to substance use, it affects every psychoactive substance. So whether alcohol, cigarette, and so on, people who use them are being stigmatized. Then in terms of the government, let me also say that the government may not directly be stigmatizing persons who use drugs, but their perception about those who use drugs tend to be based on their understanding, and at the same time, treats persons who use drugs in a stigmatizing way. And how do I mean? When Dr. Ofole was making her presentation, she did talk about structural stigmatization. And I also want to tie, the response of government to that aspect of stigmatization. For example, do government see reasons why treatment and rehabilitation centers, should be built for persons who have substance use disorders? There have been advocacy towards standalone treatment and rehabilitation centers from neuropsychiatric hospitals. But that seems not to have received much attention, because even though substance use disorders is part of mental disorders, but at the same time, from different climes, including Nigeria, you discover that some persons who have substance use disorders are reluctant to go to neuropsychiatric facilities, because they tempt people who receive treatment there or attention there as psychotic patients, even though that on its own is stigmatizing, because they have health conditions. But why would you want to identify with such people? But there have been advocacy to have standalone facilities, for persons who have substance use disorders, with professionals from different disciplines to attend to such individuals. Managing substance use disorders requires multidisciplinary approach. But again, the attention of government is such that it is not a priority, because they especially those in position of authorities, based on their perception, these are those who want to self-destroy. And since they want to self-destroy by using any of the psychoactive substances, let them face the consequences. So the limited attention that they receive on its own can be classified under structural stigmatization. So again, what do we do to make sure that all of this, both from the aspect of the government, the parents, even the individuals are addressed? I think that is the essence of this webinar. I want to believe that all of this have been greatly addressed. So Pamela, before I wrap up, finally, let me still call on you to see whether there's any. I think I can still see one or two questions. We still have about 5 to 10 minutes to wrap up.
Sure. The question around the adolescents, school children, and the substance use. There is the question on the prevalence on that group of persons and what we can do to prevent substance use in schools. Also, as you respond to that, somebody wants to understand what ISSUP is by responding to the question of ICAP. What is ICAP, and therefore what is ISSUP? Dr. Martin.
Okay, thank you very much. ISSUP is an acronym for International Society of Substance Use Prevention and Treatment Professionals. And ICAP is International Certification of Addiction Professionals. So ISSUP is a global association of individuals in the field of substance use prevention, treatment, recovery, research. In summary, it is more of bringing everybody who is involved in addressing the issue of substance use together under one umbrella without discriminating against primary professional background, whether you study medicine, law, criminology, and so on, because we all have a role to play as far as drug control is concerned, particularly in the area of drug demand reduction. You talk of families, for example, you talk of community, you talk of the work setting, you talk of school, and so on. So you will agree with me that people from different professional background and society belongs to these different settings. So bringing everybody together, under one umbrella, with adequate capacity, and that is where training and this webinar is coming up, so that we can educate ourselves to be able to play our roles more effectively. So that, in a nutshell, is what ISSUP stands for. Then when you talk about ICAP, it's more of certification, for individuals who have received reasonable level of training or capacity and are in practice, write exam, and eventually they get certified. This is more like, evidence that you have what it takes to practice in the field of drug demand reduction. So incidentally, the time will not be there for me to speak or explain more than what I have done now. I also want to believe that at least the attendee who asked the question possibly has gotten at least something from there. And like I will always say, ISSUP members are everywhere, over 30,000 members across the globe. So hardly will you ask questions from anyone in any country that they will not know one person that is a member of ISSUP. And if the person who asked the question is from Nigeria, please feel free to reach out to us and ask questions. You can even Google, you will see the phone numbers and other information there to use to reach out to any member of ISSUP. They will link you and possibly educate you more on this. Thank you.
Great.
Okay, sorry. If I have to take that again, I think you actually wanted me to take that on the role of schools in substance use prevention. Is that correct?
Yeah, sure.
Okay, good. Incidentally, when I was explaining about ISSUP, I did talk about it. Every person, every setting has a role to play as far as addressing the issue of substance use is concerned, even the school setting. And I'm happy to also say that part of the trainings that are going on in different parts of the world, including Nigeria, of course, training like that on the role of the school, is also there. And there are different document resource materials that also address the issue of or the role of the school setting in addressing substance use issue. But what is important is that individuals to play this role in the school setting or in any setting at all should receive the training, because we have had instances where people, in attempt to help prevent substance use, they even complicate issues, mainly out of ignorance. So that's why we request or advocate for training even before embarking on activities as far as drug demand reduction is concerned. Thank you. Pamela, over to you.
Yes, thank you. I wish to say thank you to everyone for attending this webinar. You realize the amount of information that is shared, the knowledge that we share across the globe. This webinar is attended by people from all over the world. It is a time to help ourselves understand issues around substance use and the complexities therein, so that then we can reduce the burden of disease to the individuals, to the families, and to our society. So we have a responsibility as the fraternity of ISSUP to be able to reach out to our communities, having the community as the focus, so that then we reduce the burden of disease. Those who are not yet members of ISSUP, we urge you to join ISSUP in your country. Go to the website ISSUP. You'll be able to get your national chapter. If you're in a country where there isn't a national chapter, we'll be able to support you for that to be done, because we realize the important role that ISSUP is doing across the globe to be able to reduce the disease burden due to substance use. So I want to say thank you very much. And Dr. Martin, you can close for us. From my side, bye, and thank you so much.
Okay, thank you so much. Peter, do you have any last word you can do in 30 seconds?
Yeah, thanks so much. Yeah, thank you so much for this privilege. I also want to say something about women and the use of alcohol or psychoactive substances. You know, women they're very precious, they're beautiful, so they should also be cautious of kind of substance they take, because especially if they take substance during pregnancy period, it might affect the unborn child and can also become a problem to the family and society at large. So women, we love you. Try as much as possible to stay away from alcohol and all the substances so that you can give us a healthy children. Thank you.
Okay, thank you so much, Peter. Ndidi, are you still there? Okay, it doesn't look like. So on this note, once again, I want to thank the speakers and Pamela, who joined in moderating this webinar, and again to the extended ISSUP family, in particular ISSUP UK, ISSUP Kenya, and ISSUP South Africa for this collaboration. And we definitely look forward to other series, and hopefully, I think it should be September or earlier than that. The information will be shared accordingly. So as we look forward to another presentation on this same theme, stigma and substance use. And to my colleagues, Olivia, Radolf, and others at the ISSUP head office, I would say, thank you so much for your support. Lastly, of course, I will not forget to appreciate the attendees. I can see the number already. This is really very encouraging. This is very encouraging. Thank you for being part of this webinar, and please look forward to another edition of the series. So at this moment, or at this point, let me say thank you, everyone, and bye for now. Thank you.
Thank you, sir.